My name is Robert Bernstein, and I'm the Chief of Pediatric Orthopedics at the Stephen Alexandra Cohen Children's Medical Center of New York.
I'll set you apart.
Well, Jim motivates me. Dr. Globally is a wonderful person to work for. We originally came to visit a Cambodian orphan that I had treated in Los Angeles, and that was our original reason for coming out here. And surreptitiously I met Jim and worked at the CSC, and since then we've been coming back on a fairly regular basis. Well, one of the wonderful things about this program is that it really does provide free care for children, adults, anybody that walks in the door. Jim really is aggressive about providing care for, which I think is a little different. Some of the NGOs around and about have very specific limitations of what they're able to take care of, or what they're willing to take care of, or how much they're willing to spend on people. They're sometimes not very open to people from the outside, whereas Jim really is quite a magnanimous person, and tries to get everybody
Running in circles, coming and taking.
Basically, you show up and it's like, how do I want to say it? When you show up at the CSC, it is craziness on steroids. It is just wild. There are patients, 50 patients standing outside in the 90-degree heat waiting to be seen. There's 5 people trying to see patients in a very small area. There are 3 operating room tables that are already have patients being put to sleep, and so you're running back and forth from one position to the other, trying to see patients in between operations, do the surgeries that need to be done. It really is an interesting, orchestrated. Well, the CSC has changed a lot since I first came. So 4 or 5 years ago when I got here, there was very little power equipment. We were doing osteotomies at the femur and things like that with osteotomes and a mallet, and putting in pins using a hand drill. And now Jim really has quite a variety of excellent power equipment, some of it better than the equipment that I have in the United States, or at least as good as the equipment I have in the United States. So those sorts of hurdles have improved a lot. There are patients that really need, that have real big problems, and sometimes those are difficult for us to decide whether we can really take care of them here safely, or whether we need to turn them away just because of the severity of their disease. I think that's probably the biggest hurdle. Other than that, it's one of time, having enough time to be here and take care of the patients.
Come up to meet you, tell you I'm sorry. You don't know how lovely you are.
So there's a variety of things. We certainly see a lot of congenital abnormalities here. There are patients who have neurofibromatosis. There seems to be a lot of neurofibromatosis in Cambodia, so there's a lot of complications of neurofibromatosis, spinal diseases, and everything from tuberculosis to scoliosis, post-traumatic things, neglected trauma, and infections. And so I think that pretty much runs the gamut. And then there's also the occasional tumor that comes in. So overall, I think that these patients have quite a bit of pathology, and the pathology is much further along than we are normally used to seeing in the Western world.
To part. Nobody said it was
Very, very well. You're going to have to cut this bone, take out the pin, straighten the bone, put a new, bigger pin up. And the question is there anything that's forcing us to do it right now? I don't think so. So it might be better just to leave them alone and just check it 6 months or a year and then do the operation. So Can you tell Mom? Developed a really good relationship with the surgeons. We have Dr. Money, Dr. Nia. All of these surgeons are very well trained and very good at what they do and very interested in learning, which is really wonderful and I think separates them from other programs. The docs want to learn, and they're interested in lectures, they're interested in being in the operating room trying to learn new techniques, and they're really quite good, and it makes it a lovely experience for us.
He has no, he has a fibula, but no tibia. This is the end of his tibia.
All right.
Right, so he has a sort of finger for his foot. His foot is not much good. So we're going to put the fibula, we're going to put the tibia into the fibula, and cut off his foot, and then get him moving.
Originally came, we actually had a program called MOPED, Mobile Pediatric Orthopedic Education, and we brought a pediatric orthopedic surgeon every month for a year, and each one of those doctors spent 2 weeks here in the hopes of sort of promoting pediatric orthopedic surgery here, and I think that has accomplished a lot, at least I hope it has, and now my goal is to make sure that things continue to progress here, that it becomes a sustainable program, that the good surgeons here and the nurses and etc. are comfortable taking care of children with orthopedics. Well, one of the main lessons that I learned from coming to the Children's Surgical Center is that I have a lot to learn. After 18 years of practice, there's still a lot of things that I don't recognize or don't know how to take care of because it's very different here. The other thing I've learned is that if I get sick in Cambodia, I'm going to come here, and I'm not going to go to any of the other hospitals because I don't trust them. I think that the care here is really far above any of the care that you can receive anywhere else in Cambodia.